In other news, psychologically dealing with the coronavirus and its consequences has been a burden too heavy for some to bear alone. Yet in the midst of this ongoing pandemic, the health ministry in Israel is reportedly set to cut funding for in-house mental health experts across all HMOs statewide. Newly revealed documents suggesting that the cuts will result in a loss of at least 400 psychologists in the public sector alone, while exacerbating a system already plagued by a psychologist shortage and a 6-month-long waiting list for treatment. Psychologist Dr. Kamila Forkosh Lavan joins me to discuss. Dr. Lavan, thank you so much for being with us. Now, how bad of a situation is it that we're discussing here? Why does it already, as is, take 6 months to get treatment?
So the problem is actually pretty big. 6 months, that's like in a good case scenario. Often it takes over a year, and in the periphery, even more. It's a big problem. There are a shortage of psychologists that are willing to also work because the pay is not so high. There's also literally shortage of actual professionals also. And again, in the periphery, even more. One good thing that came out with this whole corona situation is that we are more open to being virtual. Often people that weren't open before now are open. That gives more access, especially, again, if you're in the periphery. However, again, we're back to the original problem of the professionals that we're lacking, and we're lacking on a very big scale.
Well, now, so the government is talking about these budget cuts, and the government claims, the health ministry specifically, is claiming that these cuts will not result in layoffs. Do you think that there's a chance of that maybe this is being blown out of proportion and that these psychologists, these 400 some, mental health professionals are not going to be laid off?
I don't see how that's possible unless they're going to redivert somehow the money in such a way that the salaries are still going to be paid. And it's not only for salaries for the professionals that are already employed, this is also new professionals that are being developed, meaning in practicum, yes? So someone needs to support all of that. That's a lot of money. And if they're already really, really short on funds, cutting those funds, I don't see how that's going to improve the situation in any way.
All right, well, let's talk maybe about options for the unfortunate people who are really most impacted by this, aside from the doctors and the health professionals who are possibly on the chopping block, but also, of course, their patients. What organizations are maybe available that can supplement or help replace psychological care in the short term or in the immediate future for these people?
So many psychologists, I'm one of them, but many psychologists will offer discounts or payment plans. There are organizations, again, if you don't know what the organizations are, you are welcome to call and reach out to all of us. We will send you can say that, okay, look, I really don't have money. Please either, if whoever you just called isn't offering discounts or payment plans, we'll be very, very happy to guide you towards the organizations that are available in your area, because it's really per area, and they will differ. There aren't really any organizations that are, how should I say, countrywide. Yeah, it's more specific per area. But do reach out, because the organizations do exist. So don't be afraid, don't be ashamed, don't be embarrassed. Do reach out to, just literally call whoever you find on the net or on Facebook or anyone that's a psychologist or a social worker, and we will guide you to the right place.
Well, and of course, I don't expect you to speak for all practicing psychologists in the country, but of those that you know of, or as much to the best of your knowledge, these same psychologists who are working at the HMOs, are they also going to be available for some of this private one-on-one, making it work with the patients on an individual case basis? Is that something that they're involved in, or is that really you need to look for the psychologists who are in a position to offer that?
So most of us, most people have also private practices, even the ones that work with an HMO or some kind of a kupa, yeah. They will also supplement their living, basically. You can't really survive just on that. So they will also have private practices. Some will be willing to see the patients that they see through the kupa also in private, some won't. But it's okay, even if they are not, they can refer to someone else. The bottom line is to reach out, because the assistance is there. For sure, reach out.
All right, Dr. Kamila Forkosh Lavan, thank you so much for being with us.
Thank you.